as I imagined it was going to be. So, um, I mean, they had me walking stairs on the third day. I don't mean like 2 or 3 steps. I mean, like we went out into the emergency evacuation, next to the uh, elevators, right? Go to the stairwell. They had me going up and down stairs. They didn't have me do anything I didn't want to do. I was willing to do it, and I felt good enough to do it. So we went for a walk a couple times a day, a few times a day. We went up and down stairs once or twice a day. Um, Never by myself. I was with a nurse. She was with me the whole time, with a little rolling walker, or just by myself. It got to the point where I didn't need that. We were just walking around together. Not quickly. I mean, I wasn't running a marathon or anything. I wasn't marching, but you can move around. Um, I didn't have any pain in my chest. I didn't have the incisions didn't hurt or anything like that. So if they want you to move, get up and move. It's good for you. It's healthy, and you need to. Um, After the catheter was out, you have to get up to go to the bathroom. I do want to say this about the 5 days in the hospital. I was in a room with a bed, right? And I woke up in a bed. However, laying in the bed, now that I'm awake and the anesthesia is wore off and I'm hooked up to tubes and all this stuff, laying in the bed was not comfortable. To lay on your back uh, with your arms down next to your side naturally spreads this apart, right? And even though it's not going to open up, it pulls on the nerves and the muscles and on the sternum. And that sensation, again, I wouldn't say painful, but very, especially the first week, very uncomfortable, very uncomfortable. Let's just put it that way. So the nurses tried to prop me up with pillows. So if you're going to lay on your back and you can get your elbows parallel with your chest, right? That's going to be much more comfortable to rest and to sleep in. And you're going to want to sleep and you're going to want to get your rest. That's when all this healing takes place, is when you're resting and sleeping. So they tried in the bed, for me anyway, propping me up with pillows. It's uncomfortable. Those hospital beds are not comfortable, at least in my opinion. So the room I was in also had a chair that reclined. And, just a medical vinyl covered hospital chair. Um, Not a nice recliner or anything, but it did recline. It was a manual, so I couldn't reach down and recline, especially hooked up to tubes and stuff. And you're in a gown and you got to, push around your IV, you know, holder and everything. And you can't, you're not going to reach down. And they don't, definitely with the sternum being broken now and needing to heal, they don't want you pushing, physically reaching over and pushing the lever on the recliner to get it to open or close, right? To kick back or to kick forward. So, but the chair was more comfortable for me. To kick back in the recliner was much more comfortable for me. To put pillows under my arms, and they're already up on the arm rests, right? So that just took all this pressure off, closed this up a little bit, and allowed me to relax. And even though I needed a nurse, actually, I needed two nurses each time I wanted to get into the chair and out of the chair because I'm not that tall. I'm 5'8", but the chair just happened to be the where you put your butt on the chair just happened to be like really high. And you can't use your arms to push yourself into the chair or to pull yourself out of the chair. And the chair didn't tilt like a power recliner. It didn't tilt like that. It just kicked back and kicked forward. So I needed a nurse to kick it forward or back for me, and another nurse. The two of them, would literally kind of under my elbows, you know, help me scoot back and scoot forward so I can get in and out of the chair. But they were very accommodating and very patient. So was I. Just be patient. I think that's good advice for you too if you're going in for surgery. These nurses are hard workers, and if you can keep your spirits up and be patient with them, they'll get you anything you need or want, you know. Um, so that was my experience in the hospital. That's pretty much the hospital part. And they signed me out, discharged me 5 days out. My dad came and got me, hopped in the minivan, ride in the back seat with the pillow over you. I was buckled in, but I didn't wear the shoulder belt. I put that behind me because to wear the shoulder strap on a seatbelt, well, I guess it'd be this way, depending upon what side of the car you're on. Ooh, even today, it's still, um, it's uncomfortable. It doesn't hurt. It never hurt, but it's sensitive here. They shave your chest and how you got little hairs coming back in. The nerves have all been cut. The muscles have all been cut, and it's sensitive. This is numb. So you ride. Excuse me. You ride in the back seat. Probably a good idea not to be riding around much anyway in the first month. But you ride around the back seat in case you get into an accident. If you're in the front seat and an airbag is deployed in an accident, it could easily blow this to smithereens. Okay? Just blow it apart and you could die. And you'd have to go back in, if you're still alive, go back in, and they're going to have to reconstruct all this again. This is going to have to be recut open. They're going to have to take those wires off and out. So ride around in the back seat, act like, your wife or your husband or whoever is your chauffeur, right? And that's just the way it's got to be. Took me home, and I started just spending most of my time in a power recliner. 2 days before I went in for surgery, another video that I watched, someone mentioned, actually several people had mentioned sleeping and hanging out in a recliner of some sort. It's more comfortable than a bed, and like at least laying flat on your back in the bed, and it's easier to get in and out of, right? So 2 days before I went in for surgery, I went and bought a power recliner. One of the ones that kick back, open and close, right? By push of a button. But it's also, I bought one of the ones where it's assisted, like, for senior citizens, if you will, right? Where it'll actually stand you up. It pushes you up, right? Best thing I ever bought. I'm sick of it now because I'm still sleeping in it. That is what is most comfortable for me. But I'm telling you, a power recliner that helps you stand up all the way, well worth the money. I spent $600 plus $100 5-year unlimited warranty on it, whatever. 700 bucks. And that's where I spent most of my time for the first 4 weeks. Because with that recliner, I didn't need help getting in and out of it. I was a little more self-sufficient. And sleeping is fine because you can adjust how far back you're tilted, right? Your feet are up, but you can adjust how far back, how upright you are when you sleep. And because you're in a chair, your arms are kind of up next to you naturally anyway on the armrests, right? You just, cover up with a blanket or something and, pass out watching Dr. Phil reruns or something. It worked for me. And it's the only way I could get to sleep or to rest. In the last couple weeks, I've tried laying on the couch. That's kind of a stepping stone between the chair and my bed because the couch has a back on it, and depending upon how you lay in it, you can use the back of the couch to kind of prop up one arm, or you can kind of lay on your side and not always on your back. After open heart surgery, laying on your side, I am a side sleeper. Laying on your side is how I would like to sleep, but haven't really been able to do it much yet. Um, it, I mean, to truly lay on your side squishes all this, and really, uh, then you do feel a little discomfort in the bone or where it's healing, right? So to completely lay on my side, not really working yet for me, but I can kind of lay on my side on the couch. Um, and it's pretty much lay on my back in the chair. It's how I sleep. Still been sleeping. Hopefully next week I can, after 8 weeks, I'm hoping I can lay flat in my bed, and then I toss and turn. That's before the procedure. That's how I normally sleep. I toss and turn all night. I like to sleep on my side, but I like to sleep on both sides. One or the other, and I'm always rolling around. I can't be rolling around unconsciously um, yet. This is not healed yet to be doing that. So keep your mind, keep your keep that in mind. Came home. I had someone with me. They wanted someone with me for the first 14 days, 24/7, for the first 2 weeks. You come home with a lot of medication. They want you to, check your blood pressure a few times a day. They want you to check your weight once or twice a day and record all of this. I kind of slacked on recording it, but mentally, I was keeping track as to any data points that were way out of whack. So, because if you put on too much weight or take off too much weight in too short of a period of time, you're going to want the doctors to know this, because it could be a complication. Okay, it could be fluid and whatnot. I had someone with me for the first close to 4 weeks, about 4 weeks. I had someone with me just about 24/7. There might have been a couple nights where I was by myself, but someone was right there again in the morning after having left late that night. So, I mean, with that power recliner, I was totally able to go get up and get something to drink, or take my meds, or reach for my phone, or use the restroom, or something like that. You don't need someone for that, but just in case something were to happen, you need someone there. Left the hospital. I was still breathing very shallow. I didn't know why at the time. But what was happening, what we later found out was happening, was I was beginning to get fluid buildup around my heart. And it's a complication that is not uncommon. It doesn't happen every time, but I was starting to get fluid built up around my heart. And it's from inflammation. Okay? Whole body has just been through a shock. And there's a lot of things going on with trying to heal things. And fluid can build up around the heart, or in other parts of your body as well. And it was also causing, I believe anyway, the doctors don't think the two have anything to do with each other, but I was also having a problem getting the bottom of my left lung to reopen, to expand all the way and reopen, because your lungs have also been disconnected during the procedure. Okay, so your body's put on a heart and lung machine that does your breathing and your respiratory and your circulatory system for you. Okay, so when they plug you back in and they put you back, your heart's pumping your blood around, and then the lungs are supposed to be, you're breathing now, and your lungs should be opening and closing on their own. They've been flattened during the procedure. That's what I was told anyway. And they need to reopen. And sometimes It takes a few weeks for them to reopen. But they have some breathing exercises they want you to do. I highly recommend using the tools that they give you. A spirometer, it's a device. Um, it's a device that you inhale with, trying to practice, if you will, breathing deeply and slowly, trying to get your lungs to reopen. And you got to do it. You got to do it. So I was getting fluid around my heart. Went in for a CT scan on a Friday. This is maybe 2.5, maybe 3 weeks. Yeah, probably around 3 weeks after surgery. And they found fluid around the heart. 3 days later, that Monday, they wanted me to go in for an echo to confirm what the CT scan found, just to make sure they're not missing anything. The echo confirmed fluid around the heart, and they immediately admitted me into the emergency room. And they required me, I didn't want to, but they required me to spend the night in the emergency room while they kept an eye on it and came up with a protocol. What were they going to do to remove that fluid? My surgeon was consulting with 2 other heart surgeons that day about my situation. My surgeon wanted to cut me again and do what's called a window. They go in down here to the left of the original incision. They cut a little window. They go in and they physically suck out or remove, withdraw the fluid. But because of where my fluid was, it was more on the sides and not in the bottom of my heart. That was still a little bit risky, and there was no way I was going to let him put me under again with another breathing tube and do another operation. We're not doing it. I flat out told him, I said, there's got to be another way. You're not cutting me again. One of his colleagues said, long story short, they agreed on a medication protocol. And so they gave me a medication. I forget the name of it. Starts with a C, but it helps. It's not Lasix. It's not a water or bloating water removal pill. I was on that in the hospital because I was retaining quite a bit of water, fluid, and other, on the bottom half of my body, from sitting in that chair as much as I was. But they gave me Lasix, and that dumped that, within 12 hours. I was pretty much gone, or maybe 24 hours. That was all gone. This is a different thing. This is a different pill. It's an anti-inflammatory pill, I believe. So it lowers inflammation in the body, which supposedly, according to the one surgeon, was going to reduce the need for the body to react the way it was reacting because of the inflammation, which was bringing fluid around the heart. So if we can stop the fluid from coming in or combining around the heart, it should naturally dissipate and the body will just absorb it. And so they gave me the medication protocol for 2 weeks and said scheduled another echo to make sure that the protocol was working. If it wasn't working, we were going to do the surgery. If it was working, which it was, 2 weeks later, went in for an echo, the fluid had drastically reduced. It's not all gone, or wasn't all gone. This is a few weeks ago, but it was drastically reduced. So we knew the medication was working. So they kept me on the medication protocol for another month and a half. We're going to do another echo and hopefully prove that it's worked completely and it's all gone. They also drew some blood, took a blood panel for looking for other inflammation markers. And inflammation is way down, way low in the body. So thank goodness for some of these meds, I don't want to be on them forever, but in acute situations, these things really help. It saved me another surgery because there was no way I was letting him in there again. I told him that, actually. my surgeon. I said, I hope you did everything. He came around like on the fourth or fifth day when I was in the hospital room before I was discharged. He came in to visit me and reassure me that everything went well, so forth and so on. And I joked with him, but I was dead serious. I said, I hope you did everything you wanted to do in there because you're not going in again. Nobody's going in there again. And he giggled, but I was dead serious. So inflammation's down, the fluid is drastically reduced. I'm feeling much better. My lungs opened up completely. I'm breathing better. At first, for the first few weeks, it was shallow breath, and each inhale triggered a cough, a dry cough. I wasn't producing anything, but it was almost like what I would imagine asthma is like. I don't have asthma. I've never had asthma, but I would inhale, and if I inhaled too deeply, it it it, it almost felt like my bronchial tubes seized up, right, and just shrunk, and all of a sudden I couldn't get air in or out, and it triggered a cough. That went on for 3 weeks. I mean, it was really annoying. It was exhausting. Um, and I just stayed patient. I kept thinking, well, it's got to get better. It's got to get better. But once the fluid started to be reduced or dissipate around my heart from that medication, and by the way, that didn't really cause me any sensation. To my knowledge, I wasn't feeling anything around my heart. There wasn't any pain or anything. There wasn't any discomfort. So to find out there was fluid around my heart was surprising to me because I initially went in for the CT scan to figure out why I can't breathe. And every time I do, it triggers a cough. Because I also didn't feel sick. They were concerned about pneumonia, and you should be concerned about getting pneumonia. But I wasn't feeling like I had pneumonia. I didn't feel ill. I felt like um, what I believe asthma would feel like, and I couldn't figure out why. It's like I want to breathe deeper, but every time I do, I cough, and I have had a couple early on. I had a couple coughing spasms where I could not stop coughing and couldn't get enough air in to keep coughing. I was in this catch-22, very uncomfortable, not scary, but concerning, um, asthmatic coughing spasm. And I got to tell you, fresh out of surgery, hold on to your pillow. You're not going to want to put anything on here because it's uncomfortable to have. I couldn't even wear a t-shirt until a couple weeks ago. So I bought open button down, extra large, very loose and able to get in, you know, into and out of button down shirts, and left all this open, down to the, last couple buttons. And so I could just lay in the recliner and keep the shirt open, and all this not touching anything, even a shirt. But when you're coughing or sneezing or laughing, and I don't know if you're going to find much to laugh about in the first few weeks, but take a pillow, or at least hold yourself, and gently press it on the sternum as you cough, as you sneeze, as you get in and out of your chair, or at least get out of the chair. Because you don't want the pressure that is built up inside from coughing, sneezing, laughing, pushes the sternum outward, right? So you need to compensate by gently pushing against the sternum with a pillow or something. But I'm telling you, when you're in a coughing spasm, and you're trying to press against your chest, it's not comfortable. That was probably the most pain I've been in during the whole procedure. Was a couple coughing spasms that went on for 30 seconds, maybe a minute, of just not being able to catch my breath, not being able to get breath in without coughing, and the coughing caused all the breath to come out, and I felt like I was gonna pass out. It was very asthmatic, and to cough within the first few weeks of coming out of surgery with this is going to hurt. It's uncomfortable. It truly is uncomfortable. It feels like it feels like someone is behind your sternum with a branding iron, a hot branding iron, and every time you cough, they from behind, right behind here, they just burn you. It's for me, it was like hot sting pain. The front didn't hurt, but it felt, I could feel it inside. It was the bone. I knew it was the bone. So anyway, um, what else? So 30 days out, went to my 30-day post-op uh, consultation. I thought it was going to be with the surgeon, but it was actually with one of the nurses that was in the operating room and worked on me. She's the one that took the vein out of my leg, I guess. That's what she told me. Um, it's kind of a consultation or interview, and she checks all the incisions. The glue, if you still got glue on there, pushes against your sternum, is feeling to make sure that it hasn't adjusted or moved. In the first few weeks, if you're not careful, reaching up over your head, picking up something that's a little heavier than you should be picking up, or it's further out, you're picking it up or carrying it further out away from your body than you should be, you may feel a click, a gentle click in here, and that's the sternum coming loose or shifting, right? And to get it to heal, you don't want it shifting. So she's going to check all this and make sure it's straight and perpendicular and lined up and nothing's, pushed out or moved around. She's going to check your incisions. She's going to ask about your medications and follow up on how you're feeling, your breathing, are you doing rehab, on and on. And for me, feeling pretty good. 4 weeks out, feeling pretty dang good. Way better than I thought I was going to be at this time. I started rehab, by the way, before we knew I had fluid around my heart. I started rehab at 2.5 weeks after surgery, which is very early. But they were okay with me starting rehab that soon. And I went twice a day. I'm sorry, twice a week. And it's at rehab that they were listening to my lungs and could hear me coughing on the treadmill and whatnot, and brought up concern and insisted I get a CT scan. So having started rehab triggered or pushed the conversation as to there's fluid around your heart. And we didn't know that. I didn't know that. And your lung hasn't opened up yet. And we got to get that open. So point is, start rehab if you can, if you're up to it. You're not going to be running a marathon. You're not even going to be walking for 15 minutes. Okay. You'll be walking for maybe 5 or 10 minutes, very slowly on a treadmill or a recumbent bike. And you're going to be monitored the whole time. That's really the big point for rehab. You're being monitored. So as you push your body and you go up to where it's a little uncomfortable or you're a little winded or what have you, and you just go a little bit further, you're doing it in a safe space where you're being monitored by nurses, blood pressure, EKG, sticky electrodes and stuff. They're on you. They're checking your weight. They're listening to you. They're watching you. And God bless them in the rehab. What a great program that is. You're not there to become Arnold Schwarzenegger or something. You're there to gently and methodically, under supervision, push yourself to being able to, after a couple months or maybe a few months, rehab's usually about 12 weeks, I guess, maybe 36 sessions. You can then, after this is healed, you can go back to the gym. You can go out for a light jog, or you can walk 5 miles or something. But to get back up to that point, to do it while being monitored in rehab is really the point of it. And it helped me because if for no other reason, the nurses were on top of the idea that you don't sound good, something's not right, your lungs not open, you're coughing more than anybody else in here, and you're the youngest person in rehab. I'm 49 and a half years old, and I'm the youngest one in there, and I'm the one wheezing and out of breath and hacking. And so they were paying attention to me. They're like, something's not right. We should get a CT scan to make sure we're not missing something. And that's what led to finding out about the fluid. So thank goodness for rehab. But I started 2.5 weeks after surgery. Might be a little early. In my case, it worked out great because I had fluid around my heart, and that's what triggered finding out about it. But from my understanding, what I've been being told is that most people don't even start rehab until after 4 or 5 weeks. So keep that in mind. But if you can go and you can get a ride, because you're going to need a ride to rehab, right? Because you can't drive yet. I recommend going. It's like 45 minutes to an hour, and they're going to monitor you, and it gives you, if nothing else, it gets you out of the house. It gets you out of the chair. It gives you a place to go. And you're not going to physically feel like, ooh, I can't wait to go walk on a treadmill. Just getting out of the chair, putting the coat on, and driving or riding to rehab, and then walking in, parking and walking, that's going to wear you out. That alone will wear you out. But do it anyway. It's so, you'll be past that discomfort within a week or two. Just go do it. Just go do it. It won't last forever. The discomfort, the pain, the soreness, it will begin to dissipate. For me, I still am sore, and my shoulders are sore, my clavicles sore and stuff. I don't know even at this point if it's so much from the surgery itself, right? Being pried open, as much as it's been 7 weeks now, and I'm sleeping in a recliner like this because this is more comfortable than this, right? But the bone, after 7 weeks, the bone is well on its way to being fused back together. Okay, so it's unless I really do something I should not do, lift something I shouldn't lift, and do it in a way that I shouldn't do it, this is not coming apart now. This is going to stay together. So now that I know that, I'm practicing rolling my shoulders back, opening my chest up more. And it's a weird sensation because these nerves are lit up, and these muscles and these nerves are lit up, but they're very pliable, right? To do it, just go to the discomfort. It's not painful, but you go to the, it's a little discomfort, and you just stretch a little further. Even in the last few days, this is starting to open up again, and it's starting to feel better. So go to rehab, work out. I'm 7 weeks out. I'm feeling good. Oh, by the way, the consultation, the 30-day post-op consultation, after she checks everything, and your lungs okay, and oh wow, you had fluid, and now the fluid has been greatly reduced. Okay, we're going to keep using that medication for another month, on and on. She'll probably sign you off on driving. So that day, the 30-day consultation, the doctors, the nurse, released me to drive. I was okay to drive my own vehicle, to drive myself. And I was excited about that because I could let my father, who was staying with me the last couple of weeks, I could let him go home, right? Because we were staying at my house. And I could let him go home, and I could get some independence again. I could get some alone time, some independence, really, right? It's so to be able to drive, and now I'm able to take myself to rehab. I'm able to do my own grocery shopping, or at least, you know, go run errands and so forth. So about 30 days after the surgery, if everything's going well, you should be okay to drive. Now, that doesn't mean I was like, yeah, I can go drive around. Like the steering wheel, it, you normally drive with my left hand on top of the steering wheel, kind of cocked, leaned off to the side in the car. 2.5 weeks ago, when I got released to do that, couldn't do it. But I can do it now. But to reach out and turn the steering wheel from top to bottom all the way around, that was not impossible, but it was uncomfortable. But they still released me to drive. So I would drive with one hand on the shoulder belt, just kind of holding the belt away from my chest, and the other hand on the bottom of the steering wheel, the side of the steering wheel. And then just, gently let go of that shoulder belt if I need both hands for some reason. I left big following distances. I go slowly. I'm hyper aware, to make sure I'm not getting into an accident or something, because I'm reacting because of my physical limitations a little slower than I normally would have. But that's starting to come back now. That was only 2.5 weeks ago, and I'm starting to feel much more normal now in the car. So yeah, that's a 7-week update. I'm sure I forgot to mention a lot of important things. If anybody has any questions, I'd like to hear them. I'll give you what my experience was like. But to sum it up, open heart surgery is a physical and mental and emotional experience. It is a roller coaster, especially if you have the time, if you're blessed with the time, even if it's a few days, to consider and think about you're actually going to do this, go through with it for whatever reason. In other words, it's not an emergency or something. You didn't roll into the hospital in an ambulance. You need to find your peace. Where or who are you going to turn to? I suggest Jesus Christ, to feel calm and settled about the decision, so that you can go in and go and begin and to go through the experience. It is not something that is easy. However, it is something that is done thousands of times a week, maybe more, all over the country, all over the world. And if it's going to help you feel better in the long run and maybe help prolong your life because you have a blockage or you have a valve or something that's failing or has failed, and you have angina. I had mild angina.